When you have a patient with having snoring, the first thing is to detect where are the levels of obstruction, which can be done as an outpatient procedure just using a flexible scope. You can find out whether you have the obstruction at the nose, at the throat, or in the tongue. The second investigation that is very important is a sleep study. Here the patient is connected to a small machine, and while they sleep soundly, the oxygen levels are measured, and the machine also measures how many times he or she stops breathing throughout the night. These two levels or these two measurements are very important because that is what shows us whether the condition is mild, moderate, or severe. It's not the intensity of the snoring. And once you have these two values, then the next thing that we do is to release or unblock the airway. And to unblock an obstruction, the best way is a surgical technique. So you do surgery on the nose, correct whatever obstruction is there. Similarly in the throat and in the tongue. A lot of people have inhibitions when they hear that there is surgery to be done in the tongue. They feel that their speech can be affected. They feel that they will not be able to eat, etc. But with all the new techniques that are being used nowadays, there are absolutely no such hazards happening. Within 4 hours after the surgery, the person will be eating something or drinking something. And immediately after the surgery, the person will be able to speak. So such fears are absolutely unfounded. And once a surgery is done and the oxygen saturation improves, the dramatic relief in the patient's lifestyle, which improves his performance, his work output, all these things are exhilarating for the doctors, because a person who never knew that obstructive sleep apnea could cause all these problems, once they are relieved and he goes back to what he has not even remembered what he had a normal life, then the results are fantastic. So sleep apnea is not a condition which should be treated mildly. If you know about any person who has a sleep apnea or snoring, please ask them to see a doctor and get treated for the same problem. Madhya.